So if you remember in the last module we finished talking about Heisenberg's uncertainty principle, one of the quantum physics theorems, and we used that to explain some of the problems in medical research and healthcare research specifically, and particularly to us as chiropractors when we're actually trying to research the chiropractic paradigm and looking at more vitalistic outcomes perhaps. So what I want to show you now is just another video by a medical practitioner talking about some of the issues in medical research which can apply and be related to us as chiropractors and the research that we'd like to see happening. Now the reason I present these videos is I'm not trying to be an antagonist to research. I'm not trying to say that it's a waste of time trying to research the outcomes of what we do. In fact, I'm completely the opposite. I believe that we should be researching functional outcomes and demonstrating the benefits of our care on a number of levels in our practice members, but it's very important that we don't get distracted by trying to do the type of research that third parties are telling us that we should do. It should be us dictating the agenda. So let's have a look at this short video, and then we'll come back and we'll continue looking at the 33 principles. So let's try and be a little bit practical at the same time as we're exploring some of these theorems of quantum physics, as we're reviewing the 33 principles of B.J. Palmer and RW Stephenson. We need to remember that we're in our practice rooms, we've got these people coming in with their particular health problems, whether that be pain, whether it be something more complex, whether it just be well-being or wellness as we call it. The bottom line is we've got these people coming to our practice and we need to deliver on the promises that we would like to make to them. So let's talk about the art of chiropractic, and let's be honest, that's what we need to be really good at. We talk about the science, the art and the philosophy, but it doesn't matter how powerful your philosophy is, it doesn't matter how convincing your science is, if your art doesn't deliver, then we have a disconnect, we have a problem in what we're delivering to our customer base, into our practice members. So what I like to talk a lot about in terms of what are we looking at when we're looking at a practice member who's standing in front of us, sitting in front of us, lying down prone in front of us, whatever the case may be. What are we interpreting? How are we assessing someone's state of well-being? And the thing we need to think about is the concept that when we're looking at someone, there's a language that's coming from their body. So it's body language. So sure, they can tell us what their symptoms are, they can tell us where it hurts, how long it hurts, what makes it worse, all these kinds of symptomatic things. But at the same time, we need to be able to look at a practice member and to a degree tell them what sort of condition they're in. And in fact, this is something that's motivated me for a long time, since in the early 90s when I attended a dynamic growth congress, and one of the old legends of chiropractic stood up and he said, "You don't ask your patients how they are, you tell them how they are." And that haunted me for months, and probably even to this day, where I've really wanted to have the tools, the technologies to be able to tell my practice members where are they along their healing journey. So in psychology they talk about the 4 levels of consciousness. They talk about being unconsciously incompetent, where you don't know the fact that you're incompetent at certain things. And then we become aware, we become consciously incompetent. So we now are aware that there's incompetencies in what we're doing, and as chiropractors, what our incompetencies are in our art. And then we evolve to the next level of being consciously competent. And then the highest level that the psychologists talk about is being unconsciously competent, to the point where you're so good at doing things that you don't even realize you're doing them. So what I like to talk about in terms of being a good clinician, in terms of being an excellent chiropractor, is being consciously intuitive, which is almost another level again, I think, because I don't really want to be unconsciously competent in my practice. I'd actually rather be consciously competent. I'd rather be aware consciously aware of the signs and the symptoms and the language that a person's body is talking to me as they're in front of me, as I said, sitting, lying down, as I'm adjusting them, as I'm assessing them. So becoming more consciously intuitive is really about the fact that in practice, I think over years we learn to ignore a lot of signs that our practice members' bodies are giving us. We start to ignore the language that's coming from our practice members. So we could look at this from a number of ways. We could be looking at the language of a person's body in motion. You know, what does it tell us about their state of wellness, their state of well-being, their state of health when their body is moving? And I think this is something that we probably don't do a lot in chiropractic, and maybe it's an area of a future growth. I know when I was going to Europe, I was approached by a company that's doing a lot of surface EMG work, and they're doing it from more dynamic points of view and actually using it as a rehabilitation tool. And I thought, you know, that's fabulous. It was really, you know, more than I was interested in learning about at that time, but you know, it sort of triggers thoughts in my mind as to what do we actually do to assess a practice member in motion. In my own practice, the main thing I look at is range of motion, you know, flexibility, and that's, to me, is a critical functional indicator. We can look at standing. So obviously from a chiropractor standing point of view, it could be standing x-rays, you know, weight-bearing x-rays. It could be a postural photo or postural assessment. You know, we could be looking at body alignment from a number of different points of view. So we can be using these different tools to determine where someone's at. Sitting, you know, I always talk about sitting being a different neurological beast to the standing beast, to the moving beast, to the lying down beast. So sitting is you know, obviously so much of our community nowadays is spending way too much time sitting. So it's critical that when they're sitting that they're in an efficient and balanced state of posture and state of being. And then prone, as chiropractors, prone is really the language that we probably look at the most. The language of the heel tension, the language of the abductor tendency, the foot flares, the foot pronations and supinations, the functional leg length inequalities, the respiratory responses, etc., etc. There's all of these different indicators that we're using when someone is lying down in front of us, other than just pressing down their spine and finding the sore spots and, you know, manipulating those. There's so much more information that we can get from our practice member, and if we get good, we can be recording this information and documenting this changes in this information through time. So just a quick overview of our art, and how do we incorporate these different aspects into our practice. Are you the sort of practitioner who's, you know, practice member just come in and they're on the table when you arrive in the room, and you know, you don't really do any kind of functional assessments of any kind, and you're just really interested in, you know, how someone's feeling, and symptomatology is the most important thing to you. You know, there could be so much more in practice for you if you really learn to expand into these functional assessments. So the picture I've got there is just really a reminder to me about what we're really looking at when we're looking at body language. And the thing I always like to remind chiropractors about is the fact that all of these indicators that we're looking at, sometimes we've been taught at an undergraduate level and even a postgraduate level that we're looking at orthopedic indicators, that we're looking at mechanistic indicators, when in fact the great majority of indicators that we're looking at are neurological indicators. You know, any form of spasm, change in tone, change in temperature, change in flexibility, change in elasticity are really a reflection of someone's neurological state, more so than they are a reflection of their mechanical state. So when you look at these pictures, we look at a picture of someone with a scoliosis, we look at a child with you know, cerebral palsy, we look at someone with Bell's palsy, or we look at someone with a post-stroke syndrome going on in their body, and you know, we could easily look at those and think about them as being tight muscles on one side and spasticity on another side, but what's underneath all of that is the neurology that's going on. And this is a critical thing as chiropractors. If we're really going to fulfill our human potential, then I think we need to really be thinking about our practice members from a neurological point of view. Try for 2 weeks to not use the word of a muscle, not mention a bone, but to talk about everything that you're doing with your practice members in terms of some kind of a nerve function, sometimes of a nerve connection. And it's difficult, you know, I've tried to do it myself. It's so easy to slip back into those habits as talking about misalignment and tightness and stiffness and restriction, you know, when in fact we should be talking about tension, tone, balance, you know, frequency, all of these different words that we can build into our vocabulary that start to communicate on a different level. And it's interesting when you force yourself to do this, the whole conversation changes with your practice members, and their comprehension of what you do as a chiropractor changes. And you know, we've continuously got this complaint about the community not getting us, when in fact the problem is we're not communicating us particularly effectively. I'm just going to show you another short historical video. Many of you have probably seen this before. I know I've seen it at different junctures through time for a long time. It's from Spears Hospital, but the reason I show this is because I mentioned before about you know, the body in motion. And the thing I really like about this video, it's showing some of the befores and afters, and it's video, and it's very powerful when you see someone's gait, you know, before and after a period of adjustments, and it's very historic kind of documentation of outcomes. But you know, to me it kind of gives me some clues as to perhaps future possibilities in terms of what we should be doing in terms of documenting the changes. We're not allowed to use testimonials, but if we've got these powerful before and after you know, case records, then who can dispute those? Who can stop you from communicating those? So let's have a little bit of a look at this short video as well.